we got to talk about it. What's happening in the next gen NCLEX? All right, everybody is freaking out. I don't think you need to freak out. Remember, the scope of practice is not changing. Everything is staying the same. It's still the same concepts. It's still the same content and information. It's just going to be a different way of asking and testing your knowledge. All right, so they will give you a scenario. A patient is sitting in a bed and they have this complaint and they have this edema and they have, this is what the monitor says and this is what their telemonitor says and everything like that. Then based on that scenario, they will ask you 5 to 8 questions. Now, this is going to be really beneficial for people who have any experience because it's so much easier to visualize the patient there and answer questions a little bit based on real life. Right now, the NCLEX gives you, if you take the whole test, 145 little scenarios and you have to jump from scenario to scenario. I think it's going to be not an easier, but a more flow, easier to follow type of test. Also, when they have select all and apply or put things in order, questions like that with multiple answers, you will get partial credit if you get part of the question right. That will count towards your final score. Now with this, the algorithm is also changing. So when it delivers you your next question or your next scenario, it's going to be a little bit smarter and more updated as to how it kind of evaluates you and serves you the next question. So I think it's going to be a great change. It will be a little bit different in the way that you approach the question and think about it. But remember, it's the same content, guys. It's the same content. Don't freak out. I love you. Yes, my course will be updated with how to approach the questions differently with the next gen content. Yes, I'm sure all the resources will be updated. All I know is that my course, the test bank, and some of the lecture content will be updated just to reflect the change and help you increase your chances of passing. So good luck. Don't freak out.